You may already have a will, a living will, you may already have some advance directives in place, but looking at being faced with a disease like ALS may change what you have in your current paperwork. And so making that decision and sitting down and talking to your family about it ahead of time is always the better option, keeping in mind that you can still change your mind. Just because you have it written down in paper, just because you've taken it to your attorney, you can always change your mind. You may make an advance directive at diagnosis and 2 years later decide that you want to change things. As your disease progresses, you may say, I've decided I don't want mechanical ventilation, whereas day one you may have wanted it. It's okay to do that. But I think it's an open discussion that should happen from date of diagnosis and should always be happening so the patient can keep asking questions of their doctor, of their clinic team, so that they're just educated and they're making an educated decision rather than a hasty decision in an emergency situation and making a decision that they may regret. I want them to make whatever decision that they make, I just want them comfortable with the decision. Sometimes a tube called an endotracheal tube is put in the mouth, down the throat, for an acute respiratory distress situation. But that tube is temporary. It should only be in a patient for 2 weeks or less, and then we're looking at a tracheostomy option. For our patients, ALS patients who are in respiratory distress, many times it's not temporary. There are the exceptions of having pneumonia or bronchitis or something like that where they just need a few days of antibiotic. But most times we're talking about tracheostomy and mechanical ventilation, allowing that machine to breathe for the patient because the patient is no longer able to do it because the diaphragm has stopped working. So that requires them to have advance directives. If they do not want that, they need to put advance directives in place that say things like, I do not want a tracheostomy, I do not want mechanical ventilation. Then it's very direct to the doctors that are at the hospital, that are in the emergency room, that the patient doesn't want any of those things. Whether the doctor thinks that it might be temporary or not, if the patient has clearly stated that they don't, then they don't. We do have those patients that haven't made the decision yet, and then they go into respiratory distress and go into a hospital. And the doctor, unfortunately, a lot of times will say, let me just put this tube in your throat and you can breathe again. And when you're in respiratory distress, that's what you want to hear is, let me be able to breathe again. But that scenario, if you haven't talked about it, then becomes a major problem. Lots of times I've witnessed patients who have been in that scenario, they get trached, and then they didn't want it afterwards. And so then we're forced with a decision of, you don't just pull it out. There are steps that are required to take you off of the ventilator and things like that. Do you want to be in the hospital? Do you want to go home to die? Those sorts of things. So eliminating all of those issues by having advance directives in place, talking to your doctor, talking to your family, and putting it in writing, on paper, letting everybody know your wishes ahead of time eliminates all of those problems in the future and those particular scenarios that, in my experience, have never had good outcomes. So definitely letting people know ahead of time is the best case for all of our ALS patients when you're talking about a respiratory distress situation.